Hello everyone, my name is Riya and I am one of the OET trainers at AJINORAH institutions. So I'll give you some idea about one of the many criteria of OET speaking assessment, that is information giving. All of you are aware that information giving is a really important aspect and I will discuss about its indicators. The first and foremost indicator is establishing initially what the patient already knows. This is one key interactive approach and here we assess their previous knowledge. Why do we do this? We do this because it helps us to determine what level of information, how much and what information the patient needs. Let's say, Mr. X, what do you already know about your condition? The second indicator is pausing periodically when giving information and using the response to guide next step. This approach is often called chunking and checking, which means we give information in small pieces, give a pause and check for the patient's understanding before we speak further, and the response we get from the patient guides us to the next step. This technique is a vital component for assessing the patient's overall information needs. When we follow this method while speaking, it gives the patient enough opportunity to contribute and let us know about both the amount and type of information they still require. The third indicator is encouraging the patient to contribute reactions or feelings. In this approach, we give an opportunity to the patient to ask questions, seek clarification and express their doubts. As healthcare professionals, we must be very explicit here because many patients are reluctant to express and are extremely hesitant to ask us questions. So, what we can do here is invite them positively, make them feel comfortable and approachable. And now, what is the fourth indicator? The fourth indicator is checking whether the patient has understood the information. This is an important step to ensure the transfer of accurate information. And here comes the importance of follow-up questions. And the final indicator is discovering what further information the patient needs. In this step, we can directly ask the patient what more information they need. This is an obvious way to prevent the omission or exclusion of important information. Does that make sense, Mr. X? Most of the patients say yes, even though they are unsure about the information because they don't want to admit that they didn't understand. In that case, using patient restatement is also an effective method, like, Mr. X, could you please tell me what we have just discussed? And with this, I conclude my session. Thank you for watching.